Someone like Danielle Smith is shown the opposite, someone who wants to just sow division, someone who doesn't want to work with the federal government and doesn't really want to work for people. And so that's a clear choice that Albertans will have, someone who can defend workers and also find ways to deliver for Albertans by working with the federal government, or someone like Danielle Smith who just wants to cause division.
Initiatives, especially just transition legislation, could affect the outcome of the upcoming election in Alberta.
I think we have to take anything that Rachel Notley says very, very seriously. Rachel has shown that as Premier, she was a strong voice for workers. She's a defender of people, and if she's raising a concern, we should be listening very carefully, and we will. That's something we take very close to heart. We know that with some of the decisions of the Biden administration around investments in clean energy, that if we don't take appropriate steps at the national level in Canada, workers might fall behind. So we do need to have a response that ensures that workers are not being left behind, that we have an investment strategy, a jobs creation strategy that ensures jobs in Canada for tomorrow and for the long term. And that's something that we have to be very aware of, and we're going to continue to work hard to make sure energy workers, resource sector workers are protected, their jobs are there for them, and that there are jobs that are long-lasting and sustainable that are built for them. And so those are things that we think are very important priorities. And I think when it comes to tackling the climate crisis, Premier Notley has shown that she is someone that can be a trusted ally and a champion for workers, but also for the environment. Someone like Danielle Smith is shown the opposite, someone who wants to just sow division, someone who doesn't want to work with the federal government and doesn't really want to work for people. And so that's a clear choice that Albertans will have, someone who can defend workers and also find ways to deliver for Albertans by working with the federal government, or someone like Danielle Smith who just wants to cause division.
Budget coming up, sort of similar to the question that my colleague asked in French. We've got the budget coming up. Do you have any must-haves that you want to see from the government in the budget that that your support will be conditional on, that you would be willing to withdraw your support of the government over?
Well, a couple of things have to be there based on what we force the government to do in our agreement, and that's the dental care. There has to be enough funds to move forward with the National Dental Care Program, which is to cover all teenagers, seniors, and people living with disabilities that qualify for the program. That has to be there for that national program where you can go into a dentist's office, you can go into a hygienist's office, and your bill will be covered. That's obviously a clear requirement that has to be in the budget. In addition, we know that we've been very forceful on the idea that we need to invest more in healthcare generally. So we want to see investments in healthcare broadly speaking as well. We've always said we need to do both. Defend what we have and expand it, and those are some of the things we expect to be in the budget.
Est-ce que Pharmacare, l'assurance médicaments, c'est un deal breaker cette année?
Oh oui, c'est absolument dans notre entente. On a forcé le gouvernement dans l'entente de introduire et passer un projet de loi sur l'assurance médicaments universelle. Donc ça c'est l'encadrement légal ou legislative framework pour aller de l'avant avec l'assurance médicaments. Donc ça doit être là dans cette année, jusqu'au fin de l'année. On doit avoir cette projet de loi introduit et puis passé.
Can you repeat that in English?
Yeah, absolutely. We need to see, according to what we force the government to do, we want to see a national framework for pharmacare presented in Parliament and passed in Parliament by the end of the year. And this is the framework necessary to move forward with universal public pharmacare. And that's something that we fought for in the agreement, we negotiated, and we expect to be there. We're going to continue to fight hard to make sure that actually happens.
And it is a deal breaker?
Well, it's a part of our agreement, so if they didn't do that, they would be breaking the deal.
In the agreement, ça parle de déposer un projet de loi, pas adopter en 2023.
C'est de passer, faire passer. It's to pass it. Yeah, it's got to be passed by the end of this year. That's just one step. There's additional steps. By the next year, there has to be a bulk purchasing plan, which is to lay out how we purchase medicine in bulk. Before that, there has to be a formulary covering all the medication that has to be covered. So these are the 3 steps that need to be put in place by the end of the deal.
Introduit et passé, juste pour être clair, introduit et passé, sinon?
Sinon, le gouvernement, ça c'est que s'il ne le fait pas, il brise les détails ou il brise les éléments de notre entente.
Mr. Singh, your MPs say that the rollout, the next steps of dental care might not happen this year. because of the issues with insurance companies, it might happen in 2024, early then. So would that be, first of all, is that acceptable? And would that be a violation of your agreement?
Yes, it would be a violation of the agreement. We said that it should be delivered by the end of this year. We want to make sure that Canadians can go to the dentist and not have to worry about racking up debt to take care of their teeth. And this is a very fundamental part of our agreement. We've said very clearly we want it done by the end of this year. That's a timeline we're going to hold the government to.
And the RCMP is saying that they aren't going to be implementing neck hold restraints. The public safety minister, after George Floyd, said that you are not allowed to use the carotid neck hold restraint. And now they're telling CBC that they're not going to listen to the public safety minister. Should the public safety minister push back? And if so, how?
Absolutely, the public safety minister should push back. The whole point of having a system where we've got elected officials that are able to make decisions around public safety is so that we can actually enforce changes. And given the serious risk that we've seen with this type of pressure hold, it absolutely should not be used. And that was the right decision to be made. And the RCMP should follow through. And if they don't, there needs to be follow-up.
Mr. Singh, is it an acceptable use of taxpayer dollars for Minister Hussen to use about 90 grand out of his constituency budget to hire a PR company that specializes in restaurants, helping out restaurants and foodies, to run his constituency communications when the head of this company has a connection with his former senior policy advisor?
These types of connections are absolutely problematic. The other example you heard from Minister Ng as well, hiring someone close to her as a friend. These are things that are just obviously problematic. There's a smell test that if something smells bad, you probably shouldn't do it. Sending money to close friends without a clear process in place obviously doesn't pass the smell test, is something that's problematic, should not be happening. And the elected officials should know better.
Mr. Singh, you said yesterday that one of the conditions tied to healthcare funding has to be no privatization. What exactly do you mean by that? I mean, for-profit clinics already exist for certain procedure services, including dental services. So clarify exactly what you mean by no privatization.
Yeah, so when it comes to our healthcare system, there's a stark difference between the existence of a public system. We already have a public healthcare system. And then opening up the door to using public money for private delivery when we already have a public system and that public system needs to be protected versus an existing private system like dental care or dental services. That's already a private system that exists, which we can move towards a public system, which is what I ultimately want to do. I want to see all of our healthcare rolled into a public system. That was actually, if you look at the commissions around healthcare, the vision of healthcare was always that we should cover people from head to toe, that it should include medication, it should include dental care, and those steps were not taken at the time when the commission was done. But that was always supposed to be the vision. In fact, many countries around the world that have universal healthcare include dental care as a component, include medication coverage. So I would like to see our care public. We know the cost of private care is that it costs more, the quality goes down, and it will cause more delays in the public system. And so when it comes to the current negotiations, we want one of the conditions that Prime Minister Trudeau talks about, the conditions, and they're very important. We agree conditions are important. One of those conditions should be that public money from the federal government should not be going towards enriching private companies. And any new money that we invest in, any new money that we invest in the healthcare system, shouldn't be going towards private delivery. That should be a condition, and that's what I meant by those comments, and I stand by that.